Hi, everyone. Welcome to our newest episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. In support of Cancer Survivorship Month, today's guest is Dr. Richard Martin, a medical oncologist in Nashville General Hospital's Dr. Robert E. Hardy Cancer Center.
Dr. Martin completed his residency and fellowship in hematology and oncology at Vanderbilt University Medical Center. He is currently Assistant Professor of Medicine, Co-Director of Clinical Oncology Trials Network, and Medical Director of Sickle Cell Center at Meharry Medical College. Today, he will share information on cancer survivorship. If you have any questions for Dr. Martin after his presentation, please feel free to comment below. Please welcome Dr. Richard Martin.
Well, thank you, Kathy and Kaylin. Honored to be talking with the group today about cancer survivorship. And with that, I'm going to pull up my talk. Hopefully everyone can see this all right. So welcome. First and foremost, I know it's a big group, but just want to say congratulations to anyone out there who's winning that battle with cancer. And to friends and family and supporters, keep up the great work in supporting those people. You know, when I think of cancer survivors, and if you're one of them, you're joining an ever-growing group. As much as 17 million people estimated in 2019, which is actually fairly common. That's about 5% or 1 in 20. To our declining mortality rates. So lower cancer death, if you needs to be, and that over the next decade, we anticipate seeing as many as 31% or 22 million people with cancer survivorship. Why is this? Well, despite what the media might tell us, and yes, we all could stand to lose a few pounds. Rates of tobacco use in the US. We're also finding cancers earlier, coming up with new tests that can detect cancers earlier. On the right shows, particularly with colon cancer screening, the improvements we've made there. I do want to point out, though, that these are national trends, and certainly coming from the state of Tennessee, we are lagging a bit behind in some of these areas, and that also these are not necessarily equal in terms of access across gender and race. So progress still needs to be made on this front as well. But once we diagnose and hopefully find cancers earlier, I just want to take a moment to appreciate the struggle and the journey that I, as a medical oncologist, put my patients through. This is going to include things often like surgery, radiation, IV chemotherapies that can be toxic, even things like stem cell transplants or organ transplants and immune-based therapies. And once we put everybody through all these treatments, there's I call it the donut of truth, which is the CT scanner, where we keep checking to see if the cancer is returning. But at the end of that journey, which never really seems to end, is that big question mark of what's next. And this is where I think for cancer survivorship, it's important, at least my mantra as a medical oncologist, is that I don't treat cancer, I treat people with cancer. And that refers to treating the entire person, thinking about their life and their goals. Some of these things are going to be the physical toll that the diagnosis and treatments have taken on us. For example, the woman on the left may be someone who had a breast cancer. She's on treatment that may cause hot flashes. She may have some arm heaviness after her surgery, and she can have some numbness in her feet from the chemotherapies. Gentleman on the right may be a prostate cancer survivor, having chronic fatigue and erectile dysfunction as complications of that. But it's not just the physical, and it's not just waiting to see if the cancer's returned, but addressing mental health. concerns about what is this lump? Is my cancer back? What are my scans? I can't seem to focus on anything. Acknowledging the emotional toll. Maybe people are having dreams about the cancer coming back, or just trying to keep busy so they don't think about it, or struggle to find that motivation after the therapy's kind of worn them down, and ultimately feeling like maybe my body will never be the same. I'll never be the person I was before my cancer diagnosis, and that's okay. My job, wanting to volunteer. Maybe you're overwhelmed with the friends who are reaching out. Or maybe on the other side, you really haven't felt comfortable finding friends or family to talk to about it. But you want to be a dad. You want to travel. There are things that you still have for your life ahead. And that can be true for people of all ages. And then finally, I think about the spiritual needs of folks wondering, why did this happen to me? What's my purpose in life? What is the bigger picture? What is God's plan? And despite your individual spiritual beliefs, the way I like to think about that is, how do we measure someone's life? And I put this example up here of a picture book because really, ultimately, what I do is I try to not just keep people alive, but I try to keep you living. And there's nothing that gives me greater joy and makes me feel like I chose the right profession than knowing after we get through this together that you're out there on a fishing trip, or you see your kid graduate from high school or college, and you share those moments with me. That makes me feel so blessed and fortunate to be a part of your life and those types of joyful experiences. And when it really comes down to it, is when we put you through all these treatments and the uncertainty, often we can just fall into the couch potato phase. And while that's certainly, there's a time and a place for that, just trying to make sure that I'm supporting people to get back out there and see the world and enjoy it. Now, for everybody, that's not necessarily going to mean being a thrill seeker hanging on the edge of a cliff. The point is just finding what matters to you. And for some people, in fact, for most of us, that just means being able to put a smile on our face, enjoy times with family, feel that connection and that closeness. And that's really what I think this is all about, is getting somebody there with their physical, mental, emotional, social, spiritual health to where they can go on living life. I wanted to conclude before Q&A of what my secrets are to that healthy life. And, like they try to sell in the books, if I tell you that these are the secrets the healthcare industry doesn't want you to know about, but they're pretty basic things. And unfortunately, the reason I bring this up is there's no pill I can give you, there's no surgery, there's nothing that can really do this for you, except that I can help coach you and guide you along the way. Some of these even I need to work on, but getting 7 to 8 hours of good sleep really pays off for our health, makes us feel restored during the day, allows us to do the things that we want to do. If we can stop smoking, as I mentioned, we're not quite there, and limit those other vices, that's going to be helpful. This one I think is really key, maintaining at least 2 meaningful relationships. And the difference here is it's really important for our health, actually, to have a relationship where we can be vulnerable, be our true selves, and have somebody accept us for who we are and know that they're not judging us. And on the flip side, to be able to provide that to somebody else, to offer a mentoring or a protector role to somebody else who may be struggling. That's really important, that we find a way to have that type of relationship with the people around us. Another thing, well, welcome to Facebook, but hopefully, most of your time is spent on engaging things like this, but trying to turn off the sensationalism, the hyperbole, things that give us stress that really we don't have any control over. There's so many things on our own back doorsteps that we do have control over, and engaging in that community gives us a better sense of self-worth. Eating healthy, whole foods, drinking lots of water, setting achievable goals is really important. I think a lot of people surviving cancer want to go all the way back to their old self, and they kind of beat themselves up if they can't get there. Small goals that you can actually accomplish really is motivating to keep you moving forward. And if you aren't able to follow through with that, forgiving yourself, breathing, knowing life will still go on. I can still do this. Prioritize the things that bring you joy, right? We all had a close call for other reasons, like just think about what brings you joy, prioritize that. And then lastly, share what makes you special. And in conclusion, I want to end on that last note, because at the end of this talk, I think one question I have for you is, what can you do? maybe as a cancer survivor, as a supporter, it's sharing your story. Share what makes you special. There's a lot of people out there that are scared of having a new cancer diagnosis, scared of what it might mean to be a survivor. Your story, your experience matters. It's going to help them. And then lastly, I will say, again, the best way to cure cancer and survive it is to prevent it from happening in the first place. So again, a lot of folks out there wondering about that lump, wondering if they should get checked. The earlier these things are found, the more likely we are to have survivors or to find things before they become cancer in the first place. So just making sure that there's a culture where this isn't stigmatized, where we can work together and share our stories really matters. And with that, I really appreciate you guys being here. Want to open it up for questions.
Well, thank you, Dr. Martin. I'm sure everyone virtually is also thinking the same thing I am. This was very informative, and I really appreciate you for all the information. We do actually have a question that came through during the live. Sherry Watkins asks, does numbness ever go away? I'm being treated, but it is not going away yet.
Sherry, that's a great question. The short answer, which I wish I had a better answer, is I don't know. What we do know, depending on the treatment that's causing it, is that the sooner we detect it, adjust therapies, the less likely it is to be permanent. Sometimes it's just about stabilizing and giving you better medications and exercises and things that can help you live a life with the numbness that you do have and prevent it from getting worse. Typically, though, with things like what we call neuropathy, the healing process, even when it does happen, we measure in the terms of 6, 12 months, even beyond. So it's a slow haul, but we don't want to get you to a place where it's so bad that if it doesn't recover, we've already gone too far. And I hope that answers your question. Happy to have you follow up if you're able to type anything else.
Let me make sure. And also, if you just joined our live, please feel free to type any questions in the chat that you have for Dr. Martin. But I do want to go back. So during the conversation, because I wrote some notes down, during the conversation, you talked a lot about, those secrets to wellness and well-being. So of course, like the physical aspects, the spiritual aspects, the emotional aspects. And one of the things that I thought was beautiful that you said, as a provider, I don't treat cancer, I treat people with cancer. And then you gave at the end, you gave one of your tips was, surrounding yourself with people. Are there any additional things that you've seen for some of the patients that you treat? Are there any other key secrets that you found, like, them having, for instance, who was that? And like in the Peanut special, Linus had his like support blankie with him all the time. Yeah. So like, are there any other things that you found, your patients have done, even the smallest things that you can share that has definitely changed their process with treatment?
Well, that's a really challenging question to answer. And one of the reasons actually why my talk, while being informative, is fairly vague, is because depending on the type of cancer you have, your age, your goals, your other health conditions, where you're at in your treatment, maybe you are somebody whose treatment was surgery, maybe you are somebody whose treatment was chemotherapy. All of those residuals are going to look very different from person to person. And so giving one specific thing to say, this works well, this doesn't, I could go on and on and on. That's literally what I do in clinic every day. So I think the point I was trying to make is it's really important. I think the most important thing is that you find a doctor, and this doesn't have to be your medical oncologist, it can be a primary care doctor who listens to you, who understands you as a human being and as a patient, not just your diagnosis of cancer, and does think about you and breast cancer survivor who got really involved with the Susan Komen Cancer Survivorship Group and does walking groups that got her exercise, able to talk out through her anxiety, and she is like a beautiful brand new person. Now, other people don't want to be involved in a large group like that. I have another woman who just got a one-on-one personal trainer coach, but for other people, that's not necessarily as affordable. So there's lots of different barriers and strengths, but I think it's just figuring out who you are. I used to be a doctor at the VA for a while, and I had lots of vets who wanted to go, some of them extremists, going on a skydiving trip, or just going deer hunting and having that fishing or hunting season again. And also, if you are on treatments, if you're surviving with a non-curable diagnosis where it's still treated and we're trying to get you as many years as possible, sometimes it's okay if you've got a cruise or a wedding or an event to say, you know what, bigger context, let's hold off, or we can bump the treatment a week. What matters in my life? And that's the kind of thought process or bigger picture that I'm trying to make. But ultimately, I would say it's about coming up with a game plan, being able to feel comfortable sharing those things with your provider so that they really know who you are as a person.
Thank you. Thank you very much, Dr. Martin.
Speaking of patients and primary care doctors, how does a patient actually end up in your care? Is it, oh, I might feel something, I need to call the medical oncologist, or do I go to my primary care physician first? How does that part work?
That's a great question. And if that was your question, Kathy, or came from the audience, whoever, that was great. There's different ways. And actually one of the things that I do in my broader hats that I wear as a researcher is focusing on quality improvement and improving our clinical operations. In general, there's really 2 different ways, or seemingly 3 different ways that people will come to us. Number 1, standard screening, meaning they didn't have any symptoms, but they had a primary care doctor, and just because of their age, whatever else, they got a screening test and it was found. Those are usually found earlier that way. Option 2 is they had a symptom. And at that point, we really don't consider it screening. We say that now the cancer has declared itself, and we find it that way. Until something is really proven as cancer, it could just be a spot in the lung, spot in the neck, some other place. Infections can cause that. Other diseases, something called autoimmune diseases, sometimes can cause lumps, sometimes old scar tissue or trauma. So we don't want to prematurely scare people to tell them that they definitely have cancer when they don't. That doesn't put a lot of faith or confidence in my abilities, but we will tell people that we're concerned and let them see our face. And the earlier that we get involved, just to say, just in case, we're going to follow you through. Lots of different prognoses. And so being accurate is really important. I really sympathize and empathize with the uncertainty and the anxiety that comes with not knowing when you get that scan that shows a lump and you don't know what it is. That's why I like to see people early to say, hey, even if this isn't, just know that I'm going to be watching this with you alongside. And if we have good news and say it's not, that nothing would make me feel better. But if it is, I'm here for you, okay? And we're going to keep having conversations. That's the way it's supposed to go. Now we have a lot of room to go in terms of screening, early detection, especially in the state of Tennessee. What I did show was a lot of great data on mammograms, pap smears. We're doing pretty good on those. Colon cancer screening, something about sticking that scope up there makes a lot of people step back, but it is a lifesaver. And if you're listening, it's better than any other test, because if you get something else, all that does is say, we think you have cancer. If you actually get a colonoscopy, if they see anything, they can remove it if it's early at the same time. So it's not only a diagnosis, but it can also be the treatment. And that's I think, unique to something like a colonoscopy, and why we advocate for that so strongly. But the new thing that really emerged in the last 10 years is lung cancer screening. That's still the most common cancer, most common reason people die of cancer. And lung cancer screening has just emerged, and only 4% of eligible people are currently getting lung cancer screened. So we have a huge way to go in terms of catching those earlier, because if we do catch it earlier with screening, it's been shown overall to decrease mortality or death by 20% in cancer death and 7% in just general life and death overall. That's huge. If we did that to the rest of the 96% of people, there could be a lot more cancer survivors out there.
Can you also talk about the Cancer Center here at Nashville General Hospital, the service offerings, and its recent accreditation?
Yeah, absolutely. So we are very proud and pleased to have been just renewed for accreditation through the Committee on Cancer, which is a group that basically judges and evaluates cancer programs throughout the country. So we had full accreditation, no marks against us. That's a consecutive achievement that we've had, and that's through the American College of Surgeons. That makes sure that when we are either diagnosing or doing a surgery or offering radiation or chemotherapy, that it's evidence-based and that it's timely and safe, and that we can prove that through good documentation and follow-up. So we're very proud of that. Our cancer center, the Robert E. Hardy Cancer Clinic, has been running for a long time now. You know, one of the reasons I came newly from Vanderbilt to here after my training was through excellent mentors, Dr. Stephen Wolf, Dr. Phil Lammers, Dr. Robin Jacobs, people who, you know, Dr. Lammers, for example, now runs clinical trials through the entire Memphis Baptist system. It's a whole consortium. We have a breast cancer center with a surgeon. We have our general surgeons. We also partner with Vanderbilt and others in town, HCA or Centennial, to provide radiation, which, although it's not a service that we have here, I have every single one of those doctors on my personal cell phone. So we're in close communication, making sure the imaging and the care plans are integrated and make sense. And this is really just the beginning. One thing I'm excited about for the Cancer Center, I was tasked after Dr. Lammers left to do trials at Memphis to continue that standard of excellence to offer emerging access to clinical trials. Didn't talk about so much that another part of cancer survivorship is, quite honestly, in the last 10 years, our therapies have gotten a lot better. There's been several Nobel Prize winning medicines, particularly as it relates to immunotherapy, which are not poisons to cancer, but actually train your body how to identify the cancer cells and attack it by yourself. That's also showing to have much longer responses because you don't just keep needing the drug to shrink the cancer. Once you learn how to fight the cancer, that process may continue on for years and years. So they're really incredible therapies. Now we need to make sure that as these things keep getting better and better, that the people at our hospital and in Middle Tennessee area have access.
Okay, I have to ask, was there any, what led you to being a doctor, and then especially a hematologist oncologist?
Okay.
There aren't many people who aren't affected by cancer. I lost my father to it. I know how, you know, this side, and then even speaking with his doctors and friends who are doctors, it just seems like probably one of the hardest specialists to go into.
Yeah, I'll try to be brief. I'm not a brief guy, as you can tell. So when I was 8 years old, all my family thought I should be a doctor. And I told them, as a cynical 8-year-old kid, that doctors are just smart people who sell out to make money. I have found actually doing the career that it's wildly different than that. Going through residency and fellowship, working 100-hour weeks, 30 to 40-hour shifts, it's tough. You really have to do it because you love it. And it was really when I was at the end of college trying to figure out, do I sit in a lab and try to come up with some discoveries, that it was the equity part that really resonated with me, that we have lots of treatments out there, life-saving treatments that already exist. You don't need to come up with the next thing. There are great people who do that, but just having the compassion and the drive to get those treatments to everybody, and to listen to folks and to connect with them at that level, that was really the part that I thought would be rewarding, and I've never really looked back. It has been coming to Nashville General, where I call it kind of the DMV of healthcare. Everybody, we're everybody. I know folks with the platinum insurance may be seeing some of our local partners, but we're welcome to see you too. And as I said, we have a real strong track record of excellence in our cancer care here too, which I'm very proud of. I wouldn't work for a place if I didn't think it was at my standard, and I'm pleased to be here. But that being said, yeah, I do, to your point, I've lost a couple of my grandparents to lymphomas while I was in medical school, and learning about cancer for the first time in detail while that was happening. And I think it was really a part of the fact that my family didn't understand that diagnosis, and maybe the doctors were talking over them. I happened to be the first person in my family that went to college. That really resonated with me. Say, this is a really scary thing that people go through, and if you can't talk to somebody on a human level, then that's like a double insult. Cancer's tough enough, but you really need somebody who can be your champion in those times. And that's why, regardless of the outcome, people who are surviving, people who unfortunately don't live so long, or go on things like palliative care and hospice, that no matter what that journey is, that I can feel proud of myself for being there for folks as they're going through that. That's the part that makes it okay with me, because if I'm not there, who is? And somebody needs to be. So that's what gets me through it, and helps me wake up every day motivated to care for people.
I love that. And I think everybody in the Cancer Center has that same servant heart that you are showcasing right now. And even having the privilege of knowing Dr. Wolf and Dr. Lammers, I can see how they were mentors to you. So thank you.
Well, thank you again, Dr. Martin, for everything that you've shared. And I even echo Kathy's sentiments. I'm going to have to definitely share everything with you after this call, but you have received, and the Cancer Center and the other providers have received so much love in our Facebook comments. Everyone's commenting and saying, how much they love and coming to Nashville General for their treatment, that the accreditation is well deserved, how they've enjoyed every single session, and especially this talk. So we really appreciate you. So that is all the time that we have today. But thank you all. Thank you, Dr. Martin, for speaking with us on cancer survivorship. And if you have any additional questions, or you need to see a hematologist or oncologist, please call and make an appointment at 615-341-4968 to schedule an appointment with Dr. Martin. Again, that number is 615-341-4968. You may also visit our website at nashvillegeneral.org.
Kaylin?
Yes.
If I may just add, please call that number. It's better to reach out if you are concerned about the possibility that you may have a cancer, and we don't know that yet. We certainly want to get you into a primary care doctor, or somebody who can help you with the diagnostic tests and the screening, because again, that's where we find these things early, get the cures. So I don't want anyone to call that number necessarily and say, we won't see you, or sorry, you went to the wrong place. So I just want to be clear about that. But please, reach out, and I'm going to let my staff know that, after this session and this meeting, there may be people who are wondering what's going on, and we want to be helpful. But just know, don't give up if we're the only place you contact. If you've got a primary care or any other doctor, try them as well, please.
Thank you, Dr. Martin, and everybody who joined us today. Mark your calendars for our next Wellness Wednesday event on Wednesday, June 23rd at 12:15. Have a great day. Bye.